Many of you are either starting vacations going into the 4th of July holiday or planning another summer getaway. And some travelers might need to take extra care if they are among the more vulnerable populations. Dr. David Persse, Chief Medical Officer for the City of Houston, joining me now this morning. Dr. Persse, so I just actually got back from Chicago, and I will say that in the busy city of Chicago, in the airport, on the airplane, one, maybe two people I saw in, hundreds would be wearing a mask. And I was wondering, does that mean something's going around, or are they still just trying to take precautions? Why would somebody need to be masking up right now?
Yeah, that's a good question. There are some folks who have some conditions. For example, let's think of a cancer patient who's on chemotherapy who doesn't want to catch anything, and they know that the chemotherapy has reduced their immune system. So they very often will be wearing masks. But there are still folks out there who are concerned about catching any of the respiratory illnesses, COVID among them, because they are at higher risk for developing serious complications. That includes the elderly, sometimes young children, people with chronic illnesses, but also, like I said, people who are on chemotherapy from cancer, and also people who are HIV that are having a hard time controlling it. All of those folks, the thing that they have in common is that their immune systems are compromised, and so they really don't want to catch anything. And so this is the type of groups that you will commonly see wearing a mask when there isn't anything big going on.
Yeah, and I think a lot of them probably wore masks too before the pandemic, and we didn't pay much attention until now. Like I said, now you see somebody in a mask and it's like, should I be wearing a mask? What's going on? What's going around? Can you remind people maybe who the vulnerable populations are? I mean, I know you just listed off some, but basically what I'm asking is, going forward throughout the summer, if you're traveling, who would you recommend wear a mask while traveling?
Well, Haley, I'm going to join into the conversation you just had about your trip to Chicago. So I recently went to an EMS conference, and when I came back, guess what? I had COVID. I have no idea who infected me. I wasn't around anybody who appeared ill. And in retrospect, I'm thinking, geez, should I have been wearing a mask? It seemed like overkill at this point, but nevertheless, I caught it. So to answer your question, older folks, and we talk about people over the age of 65, and the reason is your immune system starts to weaken. And here's the other thing is that those are the folks who should be getting vaccinated. But remember, you probably want to make sure you don't fall behind on your vaccines, because not only does your immune system weaken, but your immune system's ability to respond to the vaccine dampens a little bit as well. And so you want to make sure you stay on top of those vaccines. Young children, their immune systems, they just haven't matured yet. I'm talking children less than the age of 6. Now, it's almost impossible to get a mask on somebody under the age of 6. Yeah. But I think that the parents need to, keep it in mind if you're going to be traveling with a really small infant, and especially if you've got an infant that's got health problems, and particularly respiratory problems, you may want to talk to your pediatrician about ways you might be able to protect that child during travel. And then again, the other folks we talked about really, your folks with chronic disabilities, because they tend to have medical problems. Pregnant women or women who are recently pregnant, because pregnancy really impacts your immune system. In some ways it makes it stronger, and in other ways it makes it a little bit weaker. And then, of course, the folks we talked about, those that are on chemotherapy and those with HIV or other immune compromising, and that includes diabetics. Diabetics, their immune system is impacted by their diabetes as well. So a pretty broad swath of folks, but everybody should know if you fit into one of those groups.
Yeah, and sometimes those are such common things people forget. It makes them more vulnerable to infections. And Dr. Persse, I do hope that you're feeling okay. I know that you mentioned, staying up to date on your vaccines, and I'm sure that's why you look like you're doing well today. But are there new vaccines coming out in the fall? Like, should we be waiting for those vaccines? Or if you haven't had one in a while, should you go before you say go travel?
Yeah, that's a great question. And right now, the vaccine that's out there, the most current formulation that's out there, I don't anticipate that changing in the fall. What I am waiting to hear, and I don't know that this will happen, is to see if some vaccine combines the flu and COVID into one. There's been talk about that in the past. I've not heard anything recently, but that might be coming. That would probably be the only change. So if you're behind on your vaccine now, again, particularly if you're somebody over 65 or with one of the, in one of the groups we discussed, and you're behind, I would go ahead and get it now. Like I said, 2 weeks ago, I traveled and bada bing, I caught COVID. Now, fortunately, I had a very mild illness with it, but it is out there and you can get it. So one of the things you might want to do is stay on top of that vaccine. I don't see any changes coming up in the near future.
Okay, and where can people find the vaccine now? I mean, it's not like during the pandemic days where we just had tents everywhere.
Yeah, that's a great question. So it is available at most pharmacies, most of your neighborhood pharmacies, and the big pharmacy chains have it. Some doctors' offices have it. I would call first because not all do at this point. And then you also want to make sure that your insurance will pay for it. And if your insurance won't pay for it, you can call us at the Houston Health Department at 832-393-4220, and we'll help you find a way where you can get vaccinated if you need it.
Is there anything else going on? I know we're mentioning COVID-19, but is there anything else going around that people might need to, consider wearing a mask to protect themselves against?
Yeah, so here in the middle of the summer, this is really when we're seeing very low viral illnesses. The only thing that's out there now that is actually increasing is COVID, actually. So we are seeing an increase in the amount of COVID that we're detecting in the wastewater. Also, clinically, my colleagues are telling me that they're seeing more in doctors' offices. Fortunately, we're not seeing a lot of people getting admitted to the hospital. Yes, there are some, but the numbers are really small compared to a couple of years ago. And that's largely because people have got some form of immunity, either because of their vaccinations in the past, or they're on top of their vaccination now, or perhaps they caught COVID. So, 3-4 years ago, as a population, we had no immunity. We had no, internal protection at all. Now, here we are 4 years later, and we're developing some protection. So that's keeping the hospitalizations down, but people are still getting infected, and they're still feeling miserable. When I was infected, I didn't feel terribly bad, but I'll tell you what, I was sleeping like 16 hours a day. It just exhausted me. And that was probably my biggest symptom.
All right, Dr. Persse, you are always really great at answering all of these questions. We really appreciate it. Had no idea that we were seeing more cases of COVID right now. So good to know, especially if you're going to get on an airplane or go travel into a crowded area. We appreciate you this morning.